healthcare costs are growing at a rapidly scary rate. In fact, according to research from Peter G. Peterson Foundation, healthcare costs are projected to go up by 5.5% annually in the 10-year period between 2017 and 2027, from $3.5 trillion to $6 trillion. That's a lot of money. So if you're not getting more than a 5.5% salary increase every year, that essentially means for every dollar you earn, you'll be spending more and more of that dollar on medical care and services. And that's why choosing the right health insurance plan from your employer is so important. You want to stretch your healthcare dollars, in fact, all your dollars, out as far as possible. And that's what we're here to help you do today, to explain PPOs, EPOs, HMOs, and which health insurance plan might give you the most bang for the buck given your financial and health circumstances. For our loyal subscribers and viewers, welcome back. We love you guys. And for those of you new to Diamond Nest Egg, welcome to the #1 place to learn about money, insurance, and retirement. I'm Jennifer, first-generation American. I've spent most of my life in finance. Started working at banks like JP Morgan and Goldman Sachs at the age of 17 and graduated top of my class from NYU and Harvard Business School. And now I work on all things personal finance with young professionals and employees at places like Bloomberg, WeWork, and Marsh McLennan. So PPOs, EPOs, and HMOs, they're among the most common health insurance plans offered by employers out there. PPO stands for Preferred Provider Organization. EPO stands for Exclusive Provider Organization, and HMO stands for Health Maintenance Organization. You usually choose or change your health insurance plan during open enrollment, typically November of each year, or during qualifying life events such as marriage, birth of a child, divorce, or when you're too old to qualify for your parents' health insurance, which generally happens when you turn 26. So let's jump to the chase. The PPO is the most expensive, the HMO the least expensive, and the EPO somewhere in between the two when it comes to cost. Great, we're done then, right? If only it were that easy. Cost is, of course, one major factor when choosing your health insurance plan for the coming year, but there are some other very, very important questions you should ask yourself before you tick the HMO box just because it's the cheapest one. When it comes to health insurance plans, you're basically trying to balance out costs versus choice. While PPOs are the most expensive, they also give you the most choice amongst the three plans. Choice, flexibility, in this case, means the ability to see the doctor that you want, when you want, where you want. Similarly, while HMOs are the least expensive, they also give you the least choice. They're the least flexible relative to a PPO and an EPO. And EPOs, they're somewhere in between the two, that middle ground. Not as expensive, but also not as much choice, not as much flexibility as a PPO, but more expensive and more choice, more flexibility than an HMO. So choice, flexibility is what we're going to dive into now to help you figure out whether a PPO is the way to go for you or whether an EPO or an HMO might be more suitable. So when it comes to choice, when it comes to flexibility, there are three main areas in which a PPO, EPO, and HMO differ. Difference 1, the need for a primary care physician, or PCP. Your primary care physician, your PCP, as the name suggests, is the first doctor you go to with any medical concerns you might have, whether that's a cold, a rash, back pain, or anything else for that matter. With a PPO, you don't need to have a primary care physician. You can if you want, but it's not required. Whereas with an HMO, it is required. And again, an EPO is somewhere in between the two. Most EPOs will require a PCP, but some won't. If you're considering an EPO, call the EPO beforehand to see if a PCP is required. Difference 2 when it comes to flexibility between an EPO, PPO, and HMO is the out-of-network coverage. With every PPO, EPO, and HMO, there are in-network providers and out-of-network providers. In-network providers, including doctors, specialists, and hospitals, have contracted with the PPO, EPO, or HMO to provide services for a specific agreed-upon fee. With a PPO, you're free to see whichever doctor you want, whenever you want, wherever you want. That's why the PPO wins hands down versus the EPO and HMO when it comes to choice. Just keep in mind that seeing an in-network PPO doctor will cost you less than seeing someone out of network, often significantly less. So for example, with an in-network doctor, your PPO plan might pay 75% and you would pay 25%. And with an out-of-network doctor, your PPO plan might only pay 50% and you would have to pay the other 50%. With an EPO and HMO, you don't really have a choice. You have to see in-network doctors. If you see someone out of network, the plan pays nothing. You'd be responsible for 100% of the cost. The one exception is emergencies. In this case, an EPO and an HMO would cover the cost even if it's out of network. But, and there's always a but, be sure to check with your EPO or HMO first, because what you consider an emergency might not be an emergency for your EPO or HMO. Guys, if choosing the right health plan, getting your finances in order is turning out to be more difficult than you expected, drop us a note at jennifer@diamondnestegg.com to see if we can help simplify your financial house. Moving on to difference 3 when it comes to flexibility between a PPO, EPO, and HMO, and that's the referral requirement. So say that you wake up one morning with a massive eye infection, unsightly tears rolling out of your eye. Not that this has happened recently, but we'll save that for another video another time. With an HMO, you'd have to go see your primary care physician first, your PCP, and it would be up to your PCP to refer you onwards to an eye specialist. This is known as the HMO referral requirement. With a PPO and an EPO, you wouldn't need a referral. It's not a cumbersome two-step process like with an HMO. You can just pick your eye doctor of choice and go see him or her directly. Do keep in mind that with a PPO, an in-network eye doctor will cost you less than out-of-network. And with an EPO, you must stay in-network or it won't be covered at all, unless it's an emergency as defined by your EPO. In fact, even though the EPO generally costs more than an HMO, one of the main reasons people choose an EPO over an HMO is precisely so that they can go see a specialist without a referral from their primary care physician. Now that you know the trade-offs between cost and choice when it comes to the different health plans, here's how you can go about choosing which one might be most suitable for you. A PPO may be the best option for you if you want choice and flexibility when it comes to your doctors, and you're okay with paying more in monthly premiums, annual deductibles, and out-of-pocket costs. You may also be more inclined to choose a PPO if you fall into one of these two buckets. 1, you have a specific doctor or group of doctors whom you want to keep seeing, perhaps because you've been with them forever and don't want to switch. Ideally, they're in-network, but even if they're out-of-network, the PPO plan will still reimburse you a portion of the cost, unlike an HMO or EPO, which would reimburse you 0. And 2, if you travel often for work or pleasure, PPOs usually have a wider network of medical providers across the country. On the other hand, if cost is your primary concern and you don't mind having a primary care physician, one gatekeeper doctor who coordinates your medical care and refers you to all the specialists you might need, then an HMO might be the better way to go for you. An HMO also makes quite a bit of sense for you if you are young or in pretty good health and don't go visit the doctor often. And here's a bonus. If you are indeed young, relatively healthy, have no dependents, and some savings, you might want to consider a completely different health plan altogether that we haven't talked about here. The High Deductible Health Plan, or HDHP, which can be combined with a health savings account, an HSA, so that you can save even more money to put towards healthcare now and in the future. Check out our health insurance playlist here for more HMOs, PPOs, HDHPs, and HSAs. Or our top-rated playlist here on all things life insurance, if you're interested in taking the next step in protecting your loved ones and building generational wealth. Now, if you find that a PPO is too expensive and that an HMO is too restrictive, then give some serious thought to an EPO if your bank account allows it. An EPO will be more expensive than an HMO, but it gives you the option to go see specialists as you wish without having to visit your primary care physician. Guys, money, health insurance, life insurance, your finances. Everyone's financial journey is different. What's right for me or our clients may not be right for you. If you want to make managing your finances a bit less complicated and pick up speed on your financial journey, shoot us an email at jennifer@diamondnestegg.com. We hope you learned something new today and enjoyed this video. If you did, please don't forget to give that thumbs up and the subscribe button a gentle tap. We'll be back next week with another money-saving, wealth-building video just for you.